Hello, I would like to speak about Crohn's disease and how it is a long-term inflammatory disorder impacting the digestive tract, leading to persistent discomfort and digestive complications. This presentation will cover the causes, symptoms, diagnostic methods, treatments, lifestyle management, and future research into the disease. Throughout, I will reference research from sources such as the Crohn's and Colitis Foundation, ND, Mayo Clinic 2024, NIDDK, 2024, NICE, 2019, and Gao et al. 2022, to ensure an evidence-based discussion. The development of Crohn's disease is influenced by genetic, environmental, and immune factors. Genetic mutations, such as those in the NOD2 gene, increase susceptibility by disrupting immune system regulation. Environmental factors, including smoking, diet, and alterations in the gut microbiome, are known to exacerbate symptoms. The National Institute of Diabetes and Digestive and Kidney Diseases, 2024, highlights smoking as a significant risk factor that increases the severity of the condition. Furthermore, a dysregulated immune system erroneously targets healthy tissues, leading to persistent inflammation. Which part of the gastrointestinal tract is affected? Common symptoms include persistent diarrhea, abdominal pain, and unintended weight loss, which often occur due to poor nutrient absorption. Chronic fatigue is another frequent symptom, making daily activities more challenging for those affected. Severe cases may result in complications such as fistulas, abscesses, and rectal bleeding, increasing the risk of infection. According to Mayo Clinic, 2024, patients may also experience fever and joint pain during flare-ups, further complicating disease management. The unpredictable nature of Crohn's symptoms means that periods of remission can be followed by sudden flare-ups, making it essential for individuals to work closely with healthcare professionals to manage their condition. Diagnosing Crohn's disease requires a combination of tests due to the overlapping symptoms with other gastrointestinal disorders. Blood tests assist in detecting inflammatory markers like C-reactive protein, CRP, and erythrocyte sedimentation rate, ESR, whereas stool tests help identify potential infections. Colonoscopy and endoscopy provide direct visualization of the digestive tract and allow for biopsies, aiding in diagnosis. Advanced imaging techniques, including MRI and CT scans, help assess deeper inflammation beyond what endoscopy can detect. NICE, 2019, emphasizes that no single test confirms Crohn's, necessitating a comprehensive diagnostic approach. Although there is no found cure for Crohn's disease, treatments focus on symptom control and reducing inflammation. Medications such as corticosteroids provide short-term relief during flare-ups but carry risks with prolonged use. Immunosuppressants like azathioprine help regulate the immune response, while biologic therapies such as infliximab and adalimumab specifically target inflammation pathways. Additionally, lifestyle modifications, including dietary changes and stress management, play a significant role in improving disease outcomes. Mayo Clinic, 2024. However, despite treatment advancements, around 70% of Crohn's patients eventually require surgery to remove damaged sections of the intestine or address complications. NIDDK, 2024. Research continues to explore new treatments for Crohn's disease. IL-23 inhibitors, such as risankizumab, provide a more targeted approach to inflammation, potentially improving treatment efficacy for patients who do not respond to TNF inhibitors. Gao et al. 2022. Microbiome therapy is also being studied, with probiotic treatments and fecal microbiota transplantation shows potential in rebalancing gut bacteria and alleviating inflammation. Strober, Fuss, and Bloomberg, 2014. Additionally, stem cell therapy is being investigated for its potential to regenerate damaged intestinal tissue and reset immune responses. Although these treatments remain in experimental phases, they could offer more personalized approaches to managing Crohn's disease. Managing Crohn's disease presents several challenges. Early diagnosis is difficult because symptoms mimic other gastrointestinal disorders, often delaying treatment. Biologic therapies are effective for some patients but may lose efficacy over time. The high cost of treatment, particularly advanced biologic drugs, can limit access to care. Surgery remains an option for severe cases, but inflammation often recurs post-surgery. According to NICE, 2019, improvements in diagnostic tools and broader accessibility to emerging therapies are crucial for overcoming these challenges. Lifestyle and diet are vital for controlling Crohn's disease successfully. Those suffering with Crohn's disease are encouraged to eat foods that are high in fat and acid. It's best to avoid dairy and foods that are processed, while consuming lean proteins, whole grains, and probiotic-rich foods to promote gut health. Mayo Clinic, 2024. Hydration is also important, particularly for individuals experiencing frequent diarrhea. Keeping a food journal can help identify specific dietary triggers. Additionally, limiting alcohol and caffeine intake can prevent unnecessary irritation of the gut. Eating smaller, more frequent meals may also aid digestion and reduce symptom severity. Beyond medical treatments, self-care strategies are essential for managing Crohn's disease. Stress management techniques, including meditation, deep breathing, and exercise, can help prevent flare-ups by reducing inflammation. Smoking cessation is particularly important, as smoking worsens symptoms and increases the risk of complications. NIDDK, 2024. Staying active and doing activities like yoga and swimming may help digestive function. Adhering to prescribed medication regimens helps maintain remission and prevent symptom relapse. Additionally, joining support groups, such as those offered by the Crohn's and Colitis Foundation, provides valuable community support and access to the latest research. Future advancements in Crohn's treatment include further research into IL-23 inhibitors as an alternative to TNF inhibitors. Gao et al., 2022. Microbiome research continues to explore probiotic therapies and gut bacteria restoration methods. Strober et al., 2014. Stem cell therapy holds promise for regenerating damaged intestinal tissue and modulating the immune response. Personalized medicine is another promising avenue. Taylor shows potential in rebalancing gut bacteria and alleviating inflammation. Strober, Fuss, and Bloomberg, 2014. The Crohn's and Colitis Foundation continues to fund innovative research efforts to improve patient outcomes and treatment accessibility.